Hello, everyone. All right, is everybody ready to have some fun? Yes, indeed. So I'm Dan Weiss. I'm a professor and biomedical researcher in the College of Medicine at UVM. I'm also a would-be entrepreneur, and I've founded and run a local nonprofit classical music organization here in Burlington. Now, we relocated here 22 years ago from Seattle because of the opportunities at the University of Vermont, and it's been an incredibly fruitful and productive move. And to see the energy and the interaction and the advancements here at this conference just reinforces everything that we've been able to accomplish. So, as Kirk alluded to earlier, there is an incredible diversity, breadth, spectrum of activities going on both at the university, in the community, and things that we were going to try and leverage. And so what we have for you right now are 11 live and 1 video elevator pitch. And so again, we want to see the way cool, just use that term, way cool stuff that's going on. Now, we're trying to fit a lot into a relatively constrained amount of time. So here are the ground rules. Each of the presenters will come up and they will, as part of their pitch, introduce themselves. You have a list of the full presentations in the program. Each presenter has 3 minutes. Not a lot of time, 3 minutes. And for the presenters, there is a clock here on the stage, and it will time down. You can see it. It will be green until you have 30 seconds, and then it'll start blinking orange at you. And then after those 30 seconds, it'll start blinking red at you. And if you're not done, I will come and physically remove you from the stage and the like. But then after that, we have built in a few minutes for questions because we want to make the most of the opportunity. And so we're delighted to have a panel here of local individuals, Corinne Farrell, Corey Bronner, and Angela Presley, who sitting up here will ask questions. And again, there's a fairly limited amount of time for that. So we, of course, look for you to engage with each of the elevator pitch presenters afterwards, during lunch, during the other activities, or during the day, and make the most of it. So hopefully all the presenters are up here, and the panel is ready to go. And if you all are ready to go, all right, let's begin. First presenter, come on up.
Good morning, everyone. My name is Jason Botten. I'm a professor of medicine here at UVM, and I'm a virologist, and I have a research lab. Today, I'm going to talk to you about a program I'm helping to lead in partnership with Skylar Medical and Adam Weiss to develop a single antiviral molecule that could be used to treat multiple families of pathogenic RNA viruses. So one drug for multiple bugs. And the viruses that we are targeting include the filoviruses, influenza A virus, several of the coronavirus family members that everyone's familiar with these days, rodent-borne arenaviruses. These have a worldwide distribution, and these are a few of them listed here. Another virus called Rift Valley fever. It's carried by mosquitoes in Africa. And finally, another class of rodent-borne viruses, the hantaviruses, that have a particular footprint here in the Americas. So these viruses all have 3 things in common, at least 3 things. One is they all are potential for causing pandemics in the future. The second thing they have in common is, with the exception of 2 or 3 of these, there are no vaccines or antivirals available if we had an epidemic or pandemic starting tomorrow for these viruses. The third thing they have in common is something we've shown in our lab, and that is they all have a highly conserved interaction with a human protein shown here called ERGIC53. So what I want you to know is that this is not a protein we require for our normal health. There are many people that don't make this protein. They lead normal, healthy lives. But these viruses we've shown absolutely require this protein to complete their life cycle. So to summarize about 13 years of research in about 10 seconds, these viruses take that protein and they put it on the surface of the particle itself that they make. And it's required for them to efficiently attach to host cells and begin new rounds of infection. So we've been working with Skylar Medical to develop a panel of monoclonal antibodies that we can use to target this human protein on virus particles. We've raised some STTR phase 1 NIH money. We've raised these antibodies, and we now have shown that they do effectively neutralize 4 of these families of viruses that I've described to you, so very broad neutralization. More recently, we partnered with Weiss to use their AI-based platform to identify small molecules that will do the same thing, target ERGIC-53 on these particles. And we're a little earlier in that screening, but in our first pass, we're showing broad neutralization of the arenavirus family, and we're going to move on to the other viruses that I've described to you. So at the present time, we have 2 classes now of molecules, monoclonal antibodies or small molecules that target ERGIC-53 and broadly neutralize these viruses. We believe these are going to be, this is a safe target, right? It's non-essential for our normal health. It should also avoid things like variants of concern. This is not a viral encoded protein. This is a human protein that viruses can't choose to change. And our primary customer is the US government for stockpiling purposes. And so we're obviously trying to move this towards the market, and I'll take any questions you have. Thank you.
Hi, Jason. I have a question for you.
Sure.
So, how will delivery to the customer work in this case, as the U.S. government is stockpiling?
Yeah. So the path forward that we're looking at. So we're trying to do this with non-dilutive funds. It started with an NIH grant. We would like to continue that with an additional NIH grant, a phase 2 grant, moving on to the point where we could get to IND status. And from that point, we would then partner with BARDA, who stockpiles these countermeasures against potential threats to the nation. And so in terms of getting these to the customer, this would actually go through BARDA as a stockpiling resource. Or it could be, we could partner with someone like Emergence or another biopharmaceutical company that would like to market this. But BARDA seems to be the place that we would start with, and we've actually had discussions. We've pitched this to them, and they're very interested, but we have to get to IND status before they would become engaged.
When you started 13 years ago, what did you think the timeline would be? And then what do you think the timeline to that delivery is from today?
Well, 13 years ago, I think we used to put language in our grants that maybe this could be a target that could serve as a medicine target, right? And somewhere along the way, we met some people in the corporate world that changed their mind that maybe we can actually do this ourselves. I think at the place we're at now, we've got lead candidates. We have a phase 2 NIH grant that we put in that would allow us to essentially optimize these antibodies for potency, for affinity, test them in small animal models for efficacy. So the data we have now is all in vitro. It's in cell culture-based models. So we want to go in and show in vivo efficacy. And I think if we can show safety in those animal models as well, that would allow us to really move forward. It could be somewhere in the 3 to 5 year range unless something happens globally, right, that would accelerate the interest and the support for that.
All right, thank you, Jason. In the interest of time, moving ahead, so. All right, so next up is, welcome Diane Abruzzini.
Oh, just one. You can just cue it up. Hello, my name is Diane Abruzzini. I am a co-founder of Rigorous Technology, an industrial robotics company here in Vermont. And I'm a graduate of the UVM Sustainable Innovation MBA program. Manufacturing in the US is poised for growth. Companies are expanding production, and they're moving that production back to the United States. But how do you increase production without the necessary resources? Deloitte predicts that by the year 2030, US manufacturing sector alone will have a skilled labor gap of over 2 million individuals. Robots and automation can fill that gap, especially for dull, dirty, and dangerous tasks. But for small and medium-sized manufacturers, there's still a barrier to automation. If you're a manufacturer and you want to install a robot in your facility, typically you're going to reach out to an integrator who's going to come up with a custom configuration of different hardware components, and then they're going to write a one-off software program that pulls them all together to create a solution. The problem with creating a novel solution and then installing it in the field is you often don't know exactly what you're going to get. And so when it gets installed, it might not work exactly as expected. And you're reliant on that one or maybe two people who wrote that software program line for line to fly to your facility, debug it, troubleshoot it, update it. And typically that's a months-long process where your manufacturing facility line might be down. And in manufacturing, uptime is everything. So consider for a minute the early PC. Endlessly flexible, you could do just about anything on it, but you had to be a software developer. So the market was pretty limited. But today, we have computers in schools, in workplaces, in homes. It's largely ubiquitous because there are purpose-built applications that are designed for us as operators. You can build an entire career off of Excel. You don't need to know how to program it. We see that same trajectory for robotics. At Rigorous, we're designing purpose-built applications. Rather than robots that are flexible and can do just about anything, we deliver turnkey solutions that solve real manufacturing challenges. And we're able to do so by leveraging the RGS software library. At our core, we're a software company, and we're able to reuse the modular components of our product to efficiently stand up new systems that are already field tested. We found that this is working well with our clients because they're looking for something that can be fully supported by a team rather than an individual, and for products that are designed for operators rather than developers. And I'm available for any questions.
Perfect.
Thank
So,
you, Diane. Good to
Questions
see
from the
you.
panel?
Hi, Corinne.
Can you tell us a little bit about your customer acquisition strategy out of Vermont? How are you guys doing it?
Right now, we're largely referral-based. So we brought our first product to market in November of last year, and we did so in partnership with a company that we already had professional relationships with. We have then been selling that product to the corrugated box industry, and we've been doing so, one, by leveraging that customer to make introductions to industry peers, and two, by leveraging LinkedIn and a content strategy. So typically in robotics, the manufacturer will go to the integrator and say, I have this challenge, can you solve it? But what we're doing is we're finding the challenges, solving them, and then using digital marketing to find all of the companies across the country who have that very specific need.
So it's a pretty competitive field with a lot of big multinational players. Do you see yourself independent long-term, or is the exit strategy most likely a sale to one of those players?
It's a good question. It's an interesting market, and there are large multinational players, especially in making the 6-axis robotic arms that we utilize, so we see partnering with them long-term. We see most of our competition right now is hyper-focused on making universal robot programming tools, so they're looking at the developer and saying, what's going to make it easier for you to stand up your own robot? And we're taking a different approach. We're saying robots are actually really hard, and we have a team of robotics experts that are going to do the products and sell them to you like they're machines. So right now we're in kind of a solo lane for the time being. But long term, we do see ourselves getting acquired. We have recently taken investment, and we really value that in our ability to grow and plan to return that investment over time. Yeah.
All right, excellent. Thank you. All right, so our next presentation is a dual presentation from Bob Gramling and Donna Rizzo.
Thank you. We're professors from Colleges of Medicine and Engineering. Human vitality and suffering hinge on our intactness that we feel as a person. And understanding patients as persons is both profound and important. It's also something we've forgotten how to do in healthcare. We're here because we have an opportunity to redesign healthcare, to communicate better, and that we're in a very good position to help. So our regulatory and financial pressures are changing. They're creating incentives for healthcare to change. They're creating a massive and growing market in the person-centered care solutions industry. Our team has positioned ourselves internationally to be very good in a very specific niche of science. And that is being able to measure meaningfully and scalably what happens in clinical environments that are typically protected. And Donna's going to show you a little bit of taste of that.
So how do we go about doing that? Well, we started with some data fusion and AI tools that we had developed essentially to assess environmental sensor data. And so Bob originally asked me, do you think we can use these to actually identify what's good in human conversations? I said yes. He said, do you think we can do it if these are from recordings in noisy hospital rooms? I said, probably. And then he said, do you think we can do it if I need to identify from patients their values and their preferences just after I've told them they're seriously ill? I love a challenge. This is what it became fun. So as you can imagine, these conversations are highly contextual and extremely filled with emotions that I guess we don't normally think of as good. And so off-the-shelf methods for feature extraction, they just don't work well. And so fortunately, we had this amazing data set of 361 patient and clinician conversations where seriously ill patients after the fact self-reported feeling heard and understood. And that allowed us to solve something or tackle something known as equifinality, which is just a really fancy way of saying that the conversational features that would classify for Bob feeling heard and understood are likely not the same features that would work for me. Now, these conversations are also filled. I actually should give you one example of what a conversational feature is, and I'm going to focus on silence. These conversations are filled with real human emotion and empathy, and those points tend to cluster around moments of silence. And while those silences are hugely beneficial, physicians in particular are not really good at remaining quietly present. And so we decided to automate a machine learning pipeline to find these moments. The first algorithm in the pipeline actually finds the moments using traditional indices of sound. The second algorithm actually does it using images of sound. And the third one takes the moments that both of those agree and the text immediately before it and passes it to a third algorithm, which identifies whether they're connectional or not.
We have run out of time. Dan is coming up here. Thank you. We look forward to you helping us take our suite of algorithms into the commercial space.
No, thank you. And again, in the spirit of fairness, we really ask the presenters to keep to their 3 minutes. But again, engage with them afterwards. Plenty of opportunity. Anyway, one panel question.
How has the recent AI innovation boom impacted your business plan?
I was going to let him field the questions, but these innovations are absolutely amazing because some of the stuff that we've used to do this is really old. And if you tacked on something like they have in ChatGPT, it's going to work even better. So it's really a fun time to be doing this. I'm really excited.
All right, thank you again. Great stuff. All right, so next up we welcome Amy Trubek.
Okay. So first, what are the calls to action to Vermont and beyond that have come up in the RISE conference? Climate change, food security, preservation of biodiversity, and human flourishing that I'm connecting to. Second, how do I fit into any possible solutions? I am part of a team of UVM folks, including Sada Talib and Cynthia Beliveau, committed to, in Jay Wall's apt phrase, opening a window to what is possible. For us, this involves creating a kitchen space here at UVM, allowing for innovative teaching and research to help create sustainable food systems of the future. We need to aspire to link abstract goals and measures and our everyday realities if we want to set and meet planetary boundaries in relationship to environmental and health equity. That will happen in kitchens. Why? Because here is where the products of the natural world, and possibly the laboratory world too, are transferred into palatable and pleasurable recipes, dishes, and meals. Our sustainable food futures will come from these kitchens. Let's build a kitchen here at UVM where, in the words of Kyle Clark, we make real stuff. And following Jay Wall's dictum, we are deeply invested in things and actions that might never work out, or they just might. Delicious food could emerge. We do not need a sterile lab or an arid conference room. We need a flexible, innovative kitchen space that encourages creative problem solving. In the Sustainable Foods Lab for the Future, we will be committed to the following tenets. We have a lot more, but I'm only going to give you a few. And we have initial funding from the Food Systems Research Center. Let's transform home economics into community kitchens. What if we brought together the farmers raising the heritage wheat and apples, the foragers bringing in not just ramps, but invasive species like Japanese knotweed, the fisher people bringing in trout, but also alewife, and we work together? What if we empowered people to act? If we taught folks, from students to staff to community members, how to be more confident and better problem solvers in their own goals to improve health and well-being for themselves and the planet? And let's develop climate-smart tools, recipes, meals. What if we redesigned everything? Induction ovens, Instapots, beeswax, not cling wrap, metered emissions tools, biodegradable soaps, no plastic waste, no edible waste or plastic waste. And let's encourage co-created knowledge. What if we share everything we learn along the way, in all open access space? What if we deliver our knowledge across all platforms, from people to parties to online? So in honor of the many people around the world who have labored on our behalf to be nourished today and every day, especially our foremothers, Julia Child, my favorite, let's recenter the kitchen from the smallest apartment ones with only a hot plate and sink to the large industrial commissary ones making the bean burritos for Trader Joe's. And let's figure out how to build a better world.
Thank you, Amy. That's a huge vision, and it always starts in the kitchen, doesn't it? But tell me, where do you start? What are the first steps to making this a reality here at UVM?
Yes. So come with me to Marsh Life Sciences, where I have a space that I want to renovate. And it's next to our already existing foods lab, and I want to create the sustainable foods lab. And that will be the convening space. That will be all this equipment will be, and that's where we'll be doing all the co-created learning, teaching, and research. So that's where I'm going to start.
Excellent.
Is the innovation you expect to come out of that a product, or is it a process? Or both?
Can I say both?
Yeah.
Because as you can see, I'm aiming big here. So yeah, we want to work with people. We want to work with researchers. We want to work with stakeholders. We want to work with students. But we have a very particular kind of emergent learning approach that we take in what we do in the lab. And so we'll use that to sort of both introduce people to processes that we think can work and help them be empowered, but also to maybe help them develop products that could be then used to help solve some of these problems.
All right, thank you again. And we welcome now Taylor Moulton.
Hi, everyone. My name is Taylor Moulton, and I am a team lead for the Academic Research Commercialization Program here at UVM. And today, I am here to bring your attention to the medical-grade saline industry and introduce you to secure surgical solutions. Saline is the lifeblood of all medical systems and hospitals across the world. It allows doctors to rehydrate patients, dilute medications, and perform life-saving surgeries. Currently, the saline industry is controlled by a monopoly, and the companies involved in this industry have to ship pre-bagged saline from their warehouses to hospitals and organizations around the world. This process is time-consuming, costly, and harmful to the environment. Our device from Secure Surgical Solutions solves all of these problems. Dr. Raju Badireddy and Dr. Gruner joined together after Dr. Gruner had a life-changing experience in Rwanda while he was doing field work. While he was there, he was tasked to perform a surgery, but was unable to complete it due to the lack of saline. After this, they realized the gravity of the situation and joined together to create a suitcase-sized saline generator that creates medical-grade saline out of any water and is solar-powered. This device is unique due to many reasons, but the main reason is its patented filtration process. This process utilizes modified forward osmosis, which filters the water out and adds it to a sterile bag of minerals, creating saline solution. Now, you may or may not be thinking that this is a very time-consuming process that uses a lot of energy. This is when the electric fields embedded within the filter come in handy. They push the water through the membrane, decreasing the amount of energy used and decreasing the amount of time it takes for the process to be complete. Along with this, the electric fields also move debris off of the membrane, increasing the lifespan of the filter and decreasing the overall cost. Within 1 year, a filter can create up to 14,600 liters of saline. And after year 5, while using Secure Surgical Solutions, you will have a savings of over $235,000 in comparison to traditional saline companies. Currently, we have a target market of developing countries who are experiencing these saline shortages. Our plan of action is to pair with an organization such as the military or Doctors Without Borders so we can deploy this product to both people in these countries experiencing shortages and US citizens. Currently, we are seeking financial support and any advice from people who are well-versed in medical or humanitarian domains. Thanks.
Well done, and 3 minutes exactly.
Oh, wow.
Questions from the panel?
Nice job, Taylor. My question is about the monopoly that currently stands. What type of resistance are you going to encounter because of that structure in the market right now?
Yeah, so we definitely are going to come into the problem of not being able to fully take away the system that is in place with the monopoly on the saline companies, because a lot of organizations and stuff use this process because it's a lot easier than having your own product and creating the saline itself. So we're definitely targeting the people who are going on these missions to places where it would be more of a need, and then moving more towards deploying it throughout the United States afterwards when it becomes more developed and just more established in the organizations.
Can I ask you the same question, but inverse? So how is that a unique opportunity for you?
It's a unique opportunity because it would be an interesting way to deploy saline and decrease the amount of travel time when using the product in many different places. So it would be a better option for, for instance, the military. The service members would have to travel less to get the product, making it much safer for them and increasing the time that they can spend doing the things that they actually need to be doing on the field. So, yeah.
Do you have any sense at the cost of the device, what you would sell it for, than the add-on revenue that you'd potentially get from the consumable elements?
Yeah, so we would be selling it for $15,000, and it costs around $10,000 to make, and then the filter lasts a year, so then every year we would have a repurchase of the filter, and then just the saline bags, which are very accessible and not very costly, so yeah.
All right, thank you again, Taylor. All right, next up is Mason Tuff.
All right. Hello, everyone. My name is Mason Tuff. I am the new director of the ARC program and the operations lead for Burlington Bio. We are developing novel biomaterials and scaffolds to catalyze the scaling of cultivated meat production. Cultivated meat offers a prime pathway towards alleviating food insecurity around the world. Instead of replacing traditional agriculture, as is sort of the misconception, we are working hand in hand with farms to produce real meat at scale. And this is all efficiently, ethically, and sustainably. Now, in order to grow meat in vitro, cells need some sort of structure to stick to and metabolize on. This structure is called the scaffold, and it's pictured in steps 2 and 3 up here. It allows cells to grow and develop into various meat products. The problem is current scaffold solutions and materials are expensive, they lack versatility, and they're not compatible with growing meat at scale. Now, Dr. Rachel Floriani of UVM has developed a revolutionary scaffold which utilizes agricultural residuals and alginate. Our scaffold dramatically increases cell proliferation rates, as evidenced by these 2 cell density diagrams up here. It's composed of highly scalable ingredients, namely the agricultural residuals, and it can be fine-tuned to meet the precise material property needs of our customers. Now, there are 4 primary manufacturing techniques when it comes to scaffolds. While our competition can use 1 or 2 of these methods, we can use any of them. So this means we can sell to virtually any of our customers. Now, our monetization strategy comprises 3 primary revenue streams. Number 1, manufacturing and licensing our scaffolds and microcarriers. Number 2, sourcing key inputs for our biomaterials derived from agricultural residuals. And number 3, generating custom R&D contracts to optimize our customers' manufacturing processes. Burlington Bio was built on 20+ years of mechanical and bioengineering experience. And we've focused our efforts on materials optimization rather than full vertical integration. So what this means is we're positioned to be able to become key players in helping specific cultivated meat producers optimize their processes, and we're able to allow the entire industry to scale at large. Now, our fundamental goal is to bridge the gap between traditional agriculture systems and the cellular agriculture industry. And we do this by introducing new and diversified revenue streams, by promoting circular economies, and by supporting systems of regenerative agriculture. That's it. Thank you very much. So many other exciting things to share, so please come find me or reach out to any of these contacts. Thank you.
Great. Thank you, Mason. That was awesome. So if I understand correctly, from your business model, the first market or the first product that you plan to provide are the scaffolds. What is your timeline? What do you see as a realistic timeline, and what barriers you may experience along the way?
Yeah, so Dr. Rachel Floriani and team have been working super hard in the lab, and we've already started sort of outreach to develop contracts. We have MOUs sent out to various companies, and we're actively working and integrating our R&D processes with other companies. So ultimately, this is a new and emerging industry. You know, it's certainly in the past few months, it's kind of slowed down in terms of its hype and energy, but that's natural for any sort of revolutionary technology in the progression. But that allows us to kind of think about how we really want to position ourselves in this industry and how we can strategically place ourselves for most success. So in regards to timeline, in regards to your question, the hope is that we really have a go-to-market product within Q4 of 2024, I'd say. It may be ambitious, and actually one of the biggest kind of mistakes that a lot of companies have made is they're over-ambitious with their targets for things. But we want to be optimists. We want to work as hard as possible to reach that point.
Great, thank you.
One more question?
It seems like there's a strong educational component that has to be part of your business model, but I didn't see it laid out there. Will that detract or add to your profit margin?
It's a great question, and unfortunately, given that we only have 3 minutes for these presentations, we can't go through the full progression, of outlining this is what the industry is, this is what the specific, industry niche we're in. What we want to project as Burlington Bio is the troubles of the scaffold component in particular. So it's known that the scaffold is highly expensive in the process of cultivating meat, and it's really a point of difficulty for companies. The biggest problem for any cultivated meat producer now is scaling and figuring out their manufacturing processes. And we help with both of those things by providing an inexpensive scaffold, by providing a highly effective scaffold, and by supporting this notion of scalability, because our inputs are both inexpensive and they support these systems of circular economies. So, yeah.
All right, thank you.
Thank you.
All right, next up, we welcome Skylar Bagdon.
Hi, everyone. My name is Skylar Bagdon, and I'm the CEO of Verde Technologies. And today I'm going to be telling you about how we are defining the future of solar with thin, lightweight, flexible solar panels. Now, solar today has experienced massive growth, which is incredibly encouraging. But that growth is being held back by the inefficiencies in how we manufacture and install traditional, heavy, rigid solar panels. I don't know if anybody's ever tried to lug one of those up on the roof, but it's not the easiest thing in the world. And we manufacture these panels overseas using carbon-intensive processes. We then pay to ship those heavy panels over the seas and pay even more money to lug them up onto a roof and use concrete ballast mounting systems, steel racking, and roof punctures. This results in the installation process alone accounting for over 70% of the cost of going solar. And it means that tens of millions of roofs can't go solar at all because they don't have the structural capacity or don't have the correct shape for a traditional panel. Now, we are basing this entire system off a 70-year-old cell technology that is reaching its fundamental limits. And if we're going to push solar into the future, we have to be willing to reinvent the solar panel. And that's exactly what Verde Technologies has done. So the panel we have developed is more than 10 times lighter than a traditional rigid silicon panel. It's also developed using liquid inks that can be printed at existing printing and coating factories, like those used for beer labels and newspapers traditionally. We can then install these panels on rooftops using a peel and stick adhesive backing. No steel racking, no roof punctures, no concrete ballast mounting systems. And the cell technology itself? While leveraging a mineral called perovskites, we are able to be more efficient than a traditional rigid panel. This opens the door for solar to be more accessible, to be more affordable, and greener. Now, this technology, combined with our commercialization plans, allowed Verde to win the prestigious Department of Energy's Startup Prize. We then went on to compete in the largest clean tech startup competition in the world, where we were lucky enough to beat out 90 of the top clean tech startups on the planet. We then carried that momentum into raising our first private financing round, including a number of local angels and VCED, as well as some outside venture firms as well. Since closing that round, we were invited by MIT and Princeton to join them as the commercial partner on an $11.5 million Department of Energy grant. We continued that even farther, and just 2 days ago, and I'm announcing this for the first time publicly, Verde signed a fully exclusive deal with the National Renewable Energy Lab to license a suite of their technologies as well. Oops. You know, bringing a fundamentally new solar technology to market is not an easy thing, but neither is combating climate change. And Verde has both the technology, the team, and the ambition needed to reimagine solar and make it more affordable for all of us. So thank you so much for your time, and I look forward to taking your questions.
Outstanding. All right, panel.
It feels like this should be front page news, in every newspaper in the country. So am I missing something, or kind of what's the catch?
That's like my favorite question. Anytime somebody comes up here and says everything has changed, you should be inherently skeptical of that, right? Like, who am I to be telling you any of this? And so what's held this technology back historically has been two primary things. So it's been the stability, so they don't last as long in the field as traditional panels, as well as their manufacturability. So it's been really challenging to go from a lab scale product to a full scale product. And those are exactly the areas of innovation that have allowed Verde to be successful, and they're why we're able to, have the top experts in the field reaching out to us. So actually, you should Google Verde Technologies and perovskite solar and see the headlines that have come out. And so kind of our core innovation is a deposition technique, a printing technique, that allows us to translate very rapidly from small-scale manufacturing in laboratory environments to full-scale manufacturing using existing printing infrastructure. So we're the only company that, while we are making centimeter-scale lab cells, are also doing trials on full-scale, what they call roll-to-roll manufacturing infrastructure, and we're doing that today already.
So Skylar, there's a lot of forward-looking technology that is being implemented into Verde. Can you tell us a little bit more maybe on the AI front?
Yeah, so this is pretty exciting. I mentioned just a moment ago that stability is one of the challenges. And to make the perfect solar panel, it's kind of like baking the perfect chocolate chip cookie. You need all the right ingredients and all the right proportions. And it takes a lot of chefs in the kitchen trying a lot of different things. So what our collaborators at MIT have done is they've built a robot that, using machine learning and AI, can try essentially 1,000 different ink compositions in the space of about a minute, then zoom in on the one they like the best, blow that one up, zoom in farther, and continue using kind of this combination of AI and machine learning for material science development. They then pass off those ink compositions to Verde, and we focus on making that actually scalable and a real product that can be commercialized.
So you're the sole business partner?
There are two commercialization partners. So there is one called Cubic PV, and then Verde is the second one. Cubic is focused on kind of a traditional rigid panel where they combine it with silicon, and we're focused on what we view as the more long-term, world-changing form factor that reduces installation costs, like what you see here.
Awesome.
All right, excellent. Thank you.
Thank you.
All right, next we welcome Ben Jackson.
Hello. Those are some hard presentations to follow. So my name is Ben Jackson. I'm here today to talk to you about Jam AI. Oh, nope. Yeah, Jam AI. Professional sports organizations spend hundreds of millions of dollars on sideline players due to injuries. In the NFL alone, teams will spend over $500 million on these sideline players. Now, over $500 million on sideline players. 60% of these injuries are lower extremity injuries, and with knee injuries leading the way. Now, athletes are dealing with inconvenient tech and vague data for these types of injuries. They have access to world-class doctors and trainers, but to get a baseline or understand an injury's status, they'll have to go into a lab separate from their training, have expensive procedures done to be able to get these stats for their team. Now, this is where RECOVER.AI comes in. We provide athletes with a wearable knee sleeve, which tracks muscle activation and range of motion of the knee. With this information, we have a novel, patent-pending algorithm backed by years of research here at UVM that estimates the load on the knee itself. With this information, strength and conditioning coaches will be able to provide specific, tailored rehabilitation plans and training programs for their athletes, and coaches will be able to understand when their athletes are doing exercises or performing on the field and could lead to potential further injury. This will keep their athletes on the field for longer and have less money spent on these sideline players. Now, the current model for this business is a recurring revenue model, which is a proven business model in this field in sports tech, where the sleeves are provided as long as the software for visualizing the data. And then the total market in this area is around $40 billion in the sports tech and wearables. And some of these proven companies include devices that track GPS and location of the athlete on the field, as well as heart rate monitors. And with this, they're estimating the level of exertion of the player. But the issue lies when they try to estimate more local parameters, such as an injury or the strain on a muscle from these broad data points. This is just the wrong data entirely to capture. And this is where our team came in, and we have this product, which our research team is here shown on the left, and the business team is shown on the right, currently performing trials to prove the efficacy of the device, and we are currently seeking partners and licensing opportunities. Thank you.
Thank you, Ben. What pool of athletes are you going to target first?
Yeah, good question. So the device right now is a sleeve. So we're looking at athletes that already have uniforms that would cover that area. So in the NHL, they're already wearing padding, and a lot of their injuries are actually around the knee. So it would be really easy to incorporate it into that to athletes that already have those sorts of padding on.
Do you have data that shows efficacy in real-life applications?
Yeah, yeah. So there are. So this summer we're working on testing healthy trials and healthy patients, as well as some injured patients as well. And then from that we'll be able to prove the efficacy of the device and understand what data needs to be shown coming out to the provider.
So a quick question, if you've been able to look forward enough to see what do you anticipate the cost of this device to be?
Yeah, the cost of goods is around $50 and estimated around $200 to sell the device itself. Yeah.
All right, excellent. All right, thank you.
Thanks.
All right, next we welcome David Feurzeig.
Hi, I'm a professor here, music professor in UVM's brand new School for the Arts. And last year I launched a project to perform a free piano concert in each of Vermont's 252 towns to call attention to the climate emergency and to call into question the normality of long-distance travel and touring while celebrating Vermont's community life through music. So I stopped flying several years ago out of climate concern, which meant turning down distant engagements. So in response, I launched this radically local tour, traversing the state in our solar-charged EV while playing granges, town halls, libraries, and schools, and while challenging academia's economy of prestige, where faculty are rewarded for traveling as far away and as often as possible, even at green UVM. So remarkably, Vermont's 252 towns have retained distinct, vibrant community identities. This project both celebrates and contributes to the continuing vitality of Vermont's village centers and downtowns. At each concert, I collaborate with one or more town musicians. This creates local performance opportunities for musicians while building Vermont's network of performers. Each concert is also a fundraiser for a state or local environmental organization. So when I stopped flying, at first I kept quiet out of politeness. But to confront the climate crisis, we need collective action on a massive and unprecedented scale. And that can't happen in silence. So every concert, every article, every interview about the project helps to normalize climate conversation and climate activism. Yeah, so the cost of the project are for student wages to help with publicity and social media, for travel, and above all, for course release to allow me to continue to spend the time on the many aspects of the project, which include, for example, on the website, I write up each concert with text, pictures, and video clips. And I'll just show you a few clips now to give you some idea of the variety of locations and music and collaborators and pianos.
I've seen like a fair colleague, and I met in the county town.
David, I love the radically local aspect of it. But in thinking about how do we, or have you already, roll this out beyond Vermont to other communities?
It's funny, that you mentioned that, because in each concert I play a Scarlatti sonata because he wrote enough of them. So I play a different one in each town. He wrote, but actually not 252. He wrote 555. So I joke at the concerts, after this I can do California. But no, I haven't, although I did notice that Ohio State University, perhaps in response to this, has launched a project to play all 88 counties with university musicians. So I don't see this so much as something to scale up in terms of other people should do local state concert tours, but rather, as I talk about at each concert, just questioning in terms of modernity. What things do we do because they're really, really enormously great, like antibiotics? And what things do we do because we can, because it's cheap, because it's easy? So it's really more about forefronting the conversation about things like air travel, which, although I don't want to over-focus on individual action, is for most of us by far the most impactful thing that we do, and for most of us is by far, optional or recreational.
Following the theme of the conference, what is it unique about Vermont that allows this project to happen?
Yeah, so I think I don't know if it's unique, but it's certainly unusual and remarkable, as I mentioned, that despite Netflix and social media and the pandemic, these towns, even the tiny little towns, sometimes multiple villages in small towns, have really maintained some sort of community center, some sort of community life. And that's really remarkable. It's also remarkable, just the variety of locales and climates and communities and just sort of terroir, I guess, around Vermont, so that my wife and I doing this, one thing we say at every concert is, we don't feel any privation. It's not, oh man, this is great, but if only we were waiting in line at TSA, There's just, Thoreau said at the beginning of Walden, I've traveled a good deal in Concord. And I looked it up. Vermont is 257 times the size of Concord. So that's really, I think, we're so fortunate to get to live here. Why go anywhere else?
All right, outstanding. All right, we're getting there. So next up is Deontae Lou Alexander.
Hello, everyone. Everybody can hear me? All right. My name is Deontae Lou Alexander. I own a company called Caption Studios on Williston Road. We provide a service of videography, photography, podcast, and a state-of-the-art recording studio. So pretty much what I want to talk about is the youth that we have out here in this community. A lot of them, they talk to me, and they tell me how depressed and how lonely and how they like the fact that I open up this studio and giving them a place to, express themselves and stuff like that. So, everyone knows that investing in children and hope is investing in our future. Am I wrong? It's a bit cliche, but think about it. With RISE, we can build programs based around innovation and sustainability. The social complexity of living in our society, due to technology, our youth are learning at a more rapid pace than 20 years ago. and experience boredom and being consistently challenged. This is where I come in at. Coming up with this, whoa. How you back it up? Hey, how you back it up? There you go. I'm sorry. See, with this organization that I came up with, it's called HELPP. We will inspire and challenge our youth with the arts of music, dance, and academia. With federal funding and investing in donation, we can revamp the Common Boys and Girls Club and develop programs that shine lights in dark places where they miss. Who said learning is not supposed to be fun or entertaining? The programs that we will develop will allow the youth from the ages of 6 to 17 to learn and not realize that they're learning. With using STEM as a template, this nonprofit trying to create jobs, we're learning skill set that a program will teach. I have a plan to provide different opportunities that these organization programs in this area don't provide. This will enhance the population group of the youth where I'm targeting to succeed in life. Don't get me wrong, nothing is set in stone. This is all an idea. But I do need other brilliant minds to make this idea come to fruition. I think together as a team, we can get our youth and our progeny to get away from this and to go to this. Thank you. A little nervous. That's good.
Panel.
So sometimes it's easy to see a problem and ignore it, but obviously you're not. So what incentivized you to go this extra mile to reach out to the community and start this program?
I feel as though if we can inspire them to, to dream. I think people lost the fact that they used to dream. I don't know, when I was younger, I wanted to be like Batman or something like that. I think people forgot that, so we're going to bring that back. I need you guys' help to, let's really dig deep, put the gloves on, and get into this community and really, inspire more people.
This is an amazing program. How can we help?
I think funding. I think actually getting out there, making things more fun. Let's maybe throw some type of fundraiser, music, dance, something of that nature.
Can you provide some examples of the types of podcasts that you've already hosted?
So I haven't posted any podcasts, so my clients, they come and they record their podcast there, and they put it on their own.
All right, good. Excellent. All right, for our last in-person presentation, welcome Ryan McGinnis.
Hello. So I'm Ryan McGinnis. I'm here representing BioBee, where our mission is to transform digital mental health. Nice. Okay. So 1 out of 4 people in the US is impacted by a mental health problem. It's the leading cause of disability in our country. It's a big problem. But the mental health care system is fundamentally broken. Access to assessment and intervention is not universal. Some estimates suggest that as many as 4 million new mental health care providers would be required just to meet current demand, and we know that demand is increasing. And so digital medicine approaches may provide a solution to this growing problem, but most mental health apps that are on the market today aren't evidence-based, and those that are really just digitize existing paper-based worksheets that you may do in a clinic. So what we aim to do at BioBee is to revolutionize digital mental health. We have a platform technology that we've developed that allows us to leverage objective information about your physiology, your biology, your behavior, and groundbreaking AI technologies to create and and disseminate, bring to market new digital mental health products. And so to date, we've raised more than $2 million from NIH and NSF, non-dilutive funding that has helped us create these technologies. Our first product, Panic Mechanic, is a digital therapeutic that helps you predict when you may be likely to have a panic attack, helps you track your physiology during that attack, and allows you to receive personalized preventive interventions whenever and wherever you might need them. This technology was developed based on the largest study of panic attacks ever conducted that was done by our team. The next product that we're building aims to address the challenge of childhood mental health assessment. Here, we again are basing it off of the largest study ever conducted to study digital health study ever conducted of childhood mood disorders, again, done by our team. In parallel, we have the opportunity to partner with folks in the clinical trial space where we have existing relationships that allows us to study and understand how mental health medications are working before they're deployed to market, and ultimately reduce the costs of those clinical trials. The behavioral health market is really large. It's currently a $100 billion market that's growing. Our addressable market, digital mental health, is a $5 billion market today. It's growing rapidly. It's projected to be $70 billion by 2030. Our team brings experience building and deploying deep tech health innovations. We have clinical expertise, research expertise, and folks that have done product development and a full-time CEO. Right now, we're looking for strategic partnerships, business advising, potentially some seed funding to help us scale this exciting technology, which is BioBee, ultimately, where we're going to revolutionize digital mental health. Thank you. Questions?
So is the idea that it would be a direct-to-consumer sale, or how would you go to market with the product itself? And would you need prescriptions and
yeah, it's a great question. So I think it depends. It's a platform technology from which you can spawn a variety of products. Some of those may be consumer-facing products. Panic Mechanic is a great example. It's a direct-to-consumer product for managing panic attacks. It's currently in the App Store. There could be sort of B2B models as well, especially in the clinical trial space. We're likely selling to pharmaceutical companies, selling to contract research organizations that are looking to reduce costs of their clinical trials with more sensitive endpoints. And I think in a lot of cases, especially in the context of things like assessing childhood mental health, there's need for regulation. And so working with FDA, going through that whole regulatory process and finding potentially reimbursement mechanisms for that. But yeah, it's a great question. It's stuff we're thinking about a lot.
So, hi, Ryan.
Hi, Corinne.
So one of the things that seems like a unique selling point for your products is that it's evidence-based. Can you just say a couple of words about that?
Yeah, absolutely. So the reality in sort of the digital mental health space now, if you look at the App Store, if you search mental health, there's thousands upon thousands of mental health apps that exist. Most of those are some random developer somewhere in the world has created this app that may help reduce stress or may provide some sort of resources about anxiety. But almost none of those apps are actually evidence-based. And this is a well-recognized problem. The APA, the American Psychological Association, has created a whole task force to identify the apps that are actually evidence-based out of all this noise. And so sort of from the ground up, we're building technologies that are based on the evidence. We have mental health care providers on our team who are helping us identify the real critical unmet challenges and sort of how do we build the solutions that sort of match, embed the evidence and ultimately can help people and do the right science to support it.
All right, excellent. Thank you, Ryan. So this brings us to the end of the in-person presentations. One participant, Matt Ken, had a family issue and is unable to be here in person, but made a video in the wee hours this morning that we were going to share with you. And so whenever you guys are ready.
Everyone, my name is Matt Colin. I'm so sorry I'm unable to join you in person or in real time today, but I'm grateful to be here with you all at RISE, and I'm excited to share a brief overview of the exciting work of the Crossroads Leadership Lab. The lab is a virtual sanctuary and studio for emergent and endangered ways of knowing, being, and leading. This lab was imagined and developed by some of these brilliant individuals on the screen here and many more who aren't pictured. To give you a small sense of the community that has created and sustained this lab, on the far left here is Dr. Syra Pinto of Moon Jaguar Strategies. Next to her, Banu Kapil, a T.S. Eliot Award prize-winning poet. Mr. Greg Jacobs, tribal coordinator and elder of the Coharie Nation. Sharon Bridgeforth, Wyndham Campbell Prize Award winner in drama. Harold Gattensby, who with his brother Phil have transformed the criminal justice system across Canada and the United States. Kaylin Sullivan Tutre's award-winning poet, artist, and educator. These are some of the most formidable creative leaders and artists who work on the front lines of social change, using methods and practices that are culturally rooted and grounded in deep creativity and in love. And the lab was imagined out of years of this group and others working together in our practice-based Leadership for Sustainability graduate program. It was imagined as a space for creative knowledge-generating practices, not as a think tank, not as a solution-finding space, but really as more of a virtual sanctuary for big and bold creative visions and ideas that can respond to the complex challenges of our time. Not reacting from and to the dynamics of the mainstream dominant ways of thinking and knowing, nor using the tools of empire or colonization, but from cultural lineages and ways of knowing that are rooted in love. Our community wanted a space that felt like the most creative virtual space imaginable. And out of that space, many exciting initiatives have emerged. The community wanted a space that wasn't limited by a need to conform to problem definitions or RFPs that come from those who hold power and wealth. As Dr. Pinto says on the left here, we see what's needed for our communities, and we need a space and the resources to make that future possible. These collective and collaborative efforts are expanding the sense of how academia can be rooted in communities, generating research, knowledge, and creative contributions that don't recenter dominant ways of thinking. There are some examples of specific initiatives on the screen here. Over the last year, our lab has supported many creative projects, gatherings, podcasts, pamphlets, story projects, books, new educational and credentialing opportunities, and more. We see the space as a way to support grassroots creative leaders and initiatives that can transform how we respond to the crises of our times. As a sanctuary, as a lab, as a studio, we are forging sustaining relationships that are generating initiatives that we never could have imagined. And as we enter into our next year, we're cooking up many new exciting projects, launching new partnerships, programs, and more. And we welcome collaborators and supporters to advance these efforts. So if you are interested, please feel free to reach out to me, contact me directly using the information here on the screen. We're excited to explore possibilities and create the next chapter of the lab together. Thanks so much for having me.
All right, this brings us to the end of the elevator pitch presentations. And once again, a huge round of applause for each and every presenter. And yes, absolutely, standing ovation. And remember, they're here, engage them. There are some really interesting things. I also want to give a shout out to our technical team for a spectacular job. Thank you. All right, so I've been informed there's a little bit of a change in plan. So we are now going to move on to the Activating Circular Economy in Vermont from Casella. And this will be a 30-minute enterprise, if you will, and then we can get to lunch. So welcome to Casella.